Welcome, everyone, to today's webinar, COVID-19 Lessons from the Frontlines, How to Optimize Clinical and Patient Communication. I am Anuja Vaidya with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. We will also have a series of audience polling questions during today's webinar. When we reach each poll slide, the poll question will pop up immediately on your screen. Our speakers will give a few seconds for you to select an answer from the options on your screen and click Submit. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by turning the floor over to Julie Mills, Senior Clinical Solutions Executive with PerfectServe, to begin today's presentation.
Good afternoon. Thanks to everyone for joining us today. We're glad to have you. My name is Julie Mills, and I'm a Senior Clinical Solutions Executive for PerfectServe. I've been a nurse for nearly 20 years. And beyond my work at PerfectServe, I continue to practice nursing at the University of Tennessee Medical Center in Knoxville. I have an MBA in Healthcare Administration, and I'm currently finishing my Doctor of Nursing Practice in Healthcare Administration. So like many of you listening today, healthcare and the pursuit of best practices have long been driving forces in my life. Suffice it to say, it's not business as usual these days. With the rapid progression of the COVID-19 pandemic, healthcare organizations are working quickly to address potential capacity challenges, communication needs, patient education opportunities, clinician staffing shortfalls, and more. In many cities and states around the country, surge task forces have been formed with leaders from hospitals, health departments, and state and local governments to determine if there are enough beds and critical medical resources to meet expected demand as the number of COVID-19 patients continues to rise. Most hospitals are in an advanced stage of lockdown to limit exposure, and patients who might otherwise be admitted are instead being sent home. You won't be surprised to hear that heightened communication is critical during a crisis like the COVID-19 pandemic. Communication is always important in the care delivery process, but when situational variables are changing frequently, it's an understatement to say that staff need to be on the same page with ready access to the most up-to-date information. PerfectServe has over 20 years of experience building solutions that facilitate efficient care team collaboration. We live and breathe care delivery workflows every day. In past weeks, we've been working hand in hand with key customers on how to support and modify their clinical communication workflows to best support their COVID-19 efforts. We now have armed over 150 customer sites with new collaboration workflows, including the 3 on this webinar. We will focus on their stories in hope that it could prove valuable for other healthcare organizations as well. We've invited our customers to share insights based on the COVID-19 preparation and response strategies at their facilities. With us today are Robin Gadd-Lane, a nurse by background who serves as the Manager of Digital Transformation for Prisma Health, Brant Sloan, Nursing Informatics Coordinator at the University of Tennessee Medical Center, who also brings significant nursing experience, and Lana Vaught, a Systems Analyst at Bon Secours Mercy Health. Now, before we get started, I'd like to open the presentation with a polling question. Please add your response, and we'll display the results in a minute. How would you describe the impact of COVID-19 on your healthcare organization? Is it most of our resources are being dedicated to active COVID-19 response? It's top of mind, and impact has been moderate so far. We are preparing and have COVID-19 protocols in place, but impact has been minimal. COVID-19 has had practically no impact. Other, or not sure or not applicable. Those of you representing healthcare organizations, if you'll consider and please respond at this time. So taking a look at our results, it looks like most of you are responding that most of your resources are being dedicated to active COVID-19 response, which is not surprising in the state that we're seeing these days. There's a good chunk of you as well who responded that it's top of mind and impact has been moderate so far. Also, not surprising, as we know that there are areas that have yet to reach their peak and anticipate doing so in the next few weeks. Next, I'd like to introduce you to Robin Gadd-Lane. Robin is the manager of digital transformation at Prisma Health. She holds a master's degree in nursing informatics and spent 12 years working throughout the United States as a traveling emergency room nurse. During the COVID-19 crisis, her experience helps her team meet the communication needs for people on the front lines. Thank you for joining us, Robin. Before we dive into Prisma's use case, could you tell us a little about Prisma Health and your role within the organization?
Yes, thank you for having me. Prisma Health is the combining of the Greenville Health System and the Palmetto Health System to create the largest non-for-profit health organization in South Carolina, with 32,000 team members dedicated to serving more than 1.2 million patients annually. With respect to my role and that of my team, the focus of digital transformation is to advance care and communication through technology. We are working to create that digital front door for Prisma Health.
I know from the work your organization has done with PerfectServe that your team has really leveraged some of the self-service features of our communication platform. Can you tell us a little more about what you've done?
Absolutely. My team has actually created several COVID-19 focused communication efforts with the platform. But for today's webinar, the one I'd like to highlight is the Merit Alert. The Merit Alert stands for Medical Emergency Response Intubation Team. The organization put such a team together for each of our hospitals. The team's job is to respond to patients in respiratory distress who need to be intubated. Using our communication platform, Prisma Health uses PerfectServe's Telematic solution. We're able to take a complex communication need and turn it into a simple, quick message alert that anyone can send regardless of their location.
That's great. And how does this work in real time?
Yeah, that's pretty slick. Staff using our communication platform can easily initiate a Merit Alert. To keep this process as simple as possible, the sender just needs to remember Merit Alert. The sender would then type in the user Merit Alert, choose the message type Merit Alert, and fill in the message fields. My team created routing rules attached to the answers in these message fields that direct the message to the correct Merit team, depending on the answer for the facility location and patient location. There's a box for freehand notes as well, making sending out the alert as easy as possible.
And which care team members receive these alerts?
That depends on the patient's current location, But two groups, as you can see on the slide, are similar. If the patient is in the ED/ICU, the alert goes to the on-call anesthesiologist, rapid response nurse, rapid response respiratory therapist, and STEMI nurse for the area. If the person is in the OR/floor, the alert goes to the on-call CRNA, rapid response nurse, rapid response respiratory therapist, and the STEMI nurse for those areas. While the list looks similar, it's the work in the background of the application that actually helps direct and deliver the message correctly. One of the most powerful things about our communication platform is that these messages can be delivered based off of multiple criteria. In the case of the merit alerts directory, it's determined by the fields in the message, which pull users from on-call schedules, broadcast groups, and even some pre-assigned individual users. So when the sender selects ED/ICU or OR/floor for the patient location and then selects facility, the specific schedules are pulled to deliver the message to the right people on the call, in the right role, and in the right location.
And are there any backup or escalation measures in place for this particular workflow?
Yes. One of the greatest things about the clinical communication system like ours is that you can design an alert/reminder cycle for these messages. So, the first point of contact, as you see here on this slide, is a push notification. If the message isn't read after 1 minute, then the recipient will get a second notification, and it will go to their smart badge and or a text message sent to their phone. It's important to note that with the text message, Telemedic blocks the patient-protected information from coming across. Once the message is read, the alerting cycle that you see here is disarmed.
That's wonderful. And why has it been so important to build this specific communication workflow?
When you're dealing with a population of this size and an area this large, speed is of the essence. This workflow facilitates clear, concise, and quick communication to multiple parties at once, which improves patient outcomes. Additionally, establishing a message type like this means that no one has to worry about who's on call, who's available, or where they're located. It really makes communication between caregivers easy. And it also monitors these outbound messages to see exactly when they've been read, like an audit trail.
Can you give us a general sense of how COVID-19 has impacted your job and the hospital in general?
Yeah. As mentioned, we serve a large population here in South Carolina. So it's essential that we have the space and the equipment necessary to treat our patients who are diagnosed with this virus, as well as those who are just needing testing. An effort to ensure we could do this, the system converted one of our smaller facilities, North Greenville Hospital, into a care site specifically for COVID-19 patients, complete with negative pressure units to prevent the spread of the virus. Throughout the system, we've done the same work with several floors and units to ensure that we're prepared across the state to manage our patients. There's a lot of moving parts, and our communication platform has helped bringing those parts together.
We've learned a lot from the healthcare organizations we've served over the past weeks. What are some of the positive outcomes you've experienced so far in relation to your response efforts?
It's a tough situation. I often say those of us in healthcare hate change. But when a crisis comes, it forces change upon us. We'll pull together and we always rise to meet the challenge. This crisis has increased usage across the board at Prisma Health of our clinical communication tools. With some previously reluctant or sparse users now depending on it heavily and using it daily to stay up to date. This communication solution allows the team to respond quickly to patients who need to be intubated. This is critical because intubation is the bridge between life and death, giving time for those desperately needed treatments to take effect. We have shown with another alert where time is of essence just how powerful this tool can be. Here at Prisma Health, we've been collecting data from a few of our sites using a STEMI alert, which is now starting to show we've been able to reduce our STEMI response time to an average of 15 minutes using a similar workflow as Merit, with response teams able to be on site within 30 minutes. We're anticipating the similar effect benefits with our Merit alerts.
Has Prisma Health thought about any other opportunities to use technology for communication during this crisis?
Yes. Prisma Health already has a telehealth platform that patients can use, and we've even started deploying iPads to patient rooms for this purpose. But we're currently evaluating some other ways to quickly communicate with patients via text or unscheduled video chats. Sometimes a simple unscheduled message or video conversation does the trick. So we're looking into some solutions that provide that flexibility.
That's great, Robin. Any closing thoughts you'd like to share?
Just that the ability to rapidly notify multiple groups with seamless communication to multiple devices has been the key to our response effort. It's made our entire team feel closely connected despite not being in the same physical location.
Robin, thank you so much for sharing your story, and thanks for the excellent work your team is doing. Let's take a second to do another polling question before our next speaker. Again, those of you with representing a healthcare organization, please consider and respond. Has COVID-19 changed your healthcare organization's real-time communication workflows? Is it yes, significantly, or somewhat? No, not at all. Or not sure or not applicable? I'll pause a moment to allow you to consider and respond. Now let's review our results. Yes, significantly is an overwhelming response. So definitely a need for some real-time communication workflows. And we know that healthcare organizations are using various means of making those real-time changes to their communication processes. Many of you also responded somewhat, that you've seen some changes to those communication workflows. All right, as we move on, and before I introduce our second speaker, I'd like to discuss some of the ways COVID-19 is forcing changes to healthcare delivery models that will likely last into the future. Hospitals are on lockdown. No family members or visitors are allowed on premise, causing huge communication challenges for frontline medical staff. The need for telehealth is surging. Engaging patients and triaging them remotely and in real time is crucial for flattening the COVID-19 curve. HHS has lifted restrictions on telehealth and video usage, and COVID-19's impact on telehealth adoption will endure after the crisis has abated. There's also an ongoing shift toward value-based care. COVID-19 has accelerated the evolution toward value-based care by forcing organizations to leverage new technology solutions for patient engagement. This will be the new normal after the pandemic. PerfectServe had features on the product roadmap for situations like these, but because of the immediacy of circumstances with COVID-19, we quickly responded to customer feedback by building and deploying a solution that helps families to stay connected with and informed about loved ones they've been separated from during this crisis. We've rolled this out with several customers thus far and have others who have expressed interest. You won't find this product on our website, and this is actually the first time we've talked about it publicly. But we're excited to use our resources in a way that meets an immediate need for healthcare providers responding to COVID-19. The University of Tennessee Medical Center, which is right down the road from PerfectServe's headquarters, was the first customer to deploy this solution. We are joined by Brant Sloan, UT Medical Center's Nursing Informatics Coordinator, to talk more about the importance of direct, easily accessible communication with patients and their families during a public health crisis. Thanks for taking time to join us today, Brant. First, can you tell us a little about UT Medical Center and your role within the organization?
Sure. Glad to be here, Julie. Thanks. UT Medical Center is a 685-bed hospital in East Tennessee's only academic medical center. We're a magnet-recognized hospital and a Level 1 trauma center and serve as a major referral center for East Tennessee, Southeast Kentucky, and Western Carolina. As the Nursing Informatics Coordinator here at the Medical Center, I'm responsible for all things nursing IT, and I have worked closely with PerfectServe over the years as we implemented nurse-to-provider secure messaging and have made sure that all our screenings and data reports are up to date and in the hands of the clinicians for faster decision-making during this crisis.
Can you give us a general sense of how COVID-19 has impacted both your role and the hospital?
The impact that this pandemic has had for my role is just to make sure that the people on the front line have the technology at their fingertips to still be able to provide high-quality care and make informed decisions about that care. The Medical Center went to a strict no-visitation policy a few weeks back, as well as reduced the number of elective procedures performed. That has presented new challenges for our staff and our patients and families. We are staying ahead and planning ahead and have plans in place in case we have a possible surge and increased number of COVID-19 patients.
As I mentioned at the top of the webinar, I'm a nurse on staff at UT Medical Center, so I've seen these changes and preparations rolling out firsthand in recent weeks. Many listening today can certainly relate to that as well. Brant, I want to focus on the issue of provider-to-patient communication when a facility like yours is on lockdown. In this case, UT Medical Center, like other facilities, has restricted all visitors as part of its COVID-19 response. This can be tough for a number of reasons. Why?
Well, it's the right thing to do to reduce the risk of spreading the virus, but it does make life harder here on campus. A lot of non-essential services have been suspended, so communicating with patients we typically see in person by some other means takes more time. For our patients that are in the hospital, these restrictions mean being cut off from their loved ones during a time that's frightening and scary. For the patient's family, they can't be there to support or advise a family member when they need it most. As an example, imagine being the sole caregiver for an elderly parent and suddenly not being able to visit them at all when they're sick and in the hospital. It's stressful, to say the least.
Yes, having a sick loved one is hard enough, so adding forced distance to the equation makes it more difficult. As your team worked through its COVID-19 strategy and how much routine activities were likely to change during the outbreak, was this one of the scenarios you wanted to plan for or mitigate?
Absolutely, Julie. We have an existing relationship with PerfectServe since their communication platform is deployed throughout our hospital. So we touched base with your team to discuss ways the platform could be used or enhanced for communications during COVID-19. The idea of a quick, easy way to reach patients or provide updates to family members of patients was top of mind.
And how did that conversation evolve?
Over a few short weeks, the PerfectServe team presented us with a solution to make communication with patients and their families as straightforward and efficient as possible. I call it a quick launch, self-service patient and family texting and video chat dashboard.
And this solution went live at the beginning of April. The decision to implement was made quickly. What's the value you're seeing, and how is it helping your staff during COVID-19?
Good question. The solution was live on our pilot units in just a few hours. We didn't have to download software or to make it easy on staff, we gave PerfectServe a file to load basic info to be able to start texting patients and their families. Providers can access the tool by navigating to a dedicated URL, either on their phones or via the web, or logging in, and then they log in with their existing PerfectServe credentials. More importantly, since we're talking about text messaging, there's no app to download on the patient and or family end. They just simply receive an SMS message. Secondly, for our care team members, this solution reduces the time needed to conduct family outreach. If you're sending hundreds of updates to family members every day, having a straightforward, lightweight outreach interface that can be used from a mobile device or a workstation, it does save valuable minutes each time. Additionally, when you're dealing with such an unpredictable situation, these family members who are disconnected from the patients in the hospital really value an open line of communication for status updates. It's a source of comfort.
You make an excellent point. This solution also gives physicians the ability to engage with patients from outside the room or anywhere in the hospital without having to don PPE, which we all know is in great demand these days. When you think about it more broadly, facilitating this kind of direct contact with the patient and their family elevates the entire patient experience in the end. Could you talk a little bit more about the functionality of the platform being used?
Sure. If you're a provider, you just navigate to the URL I mentioned before to log in. You're greeted with a very straightforward dashboard. Let's say you want to message the patient's dad and brother to let them know that she's ready for pickup. After searching for the patient, you can select both the dad and brother and send them a quick message. For common scenarios like this one, we can ask PerfectServe to load pre-written message types. So all the provider has to do is select the right message type from the drop-down menu. As a safeguard, the solution also asks the sender to confirm that the message does not contain protected health information.
In addition to having free-form text as an option, what reason might there be to use predetermined message templates like you've chosen to do at UT?
Depending on your organization's policies, using approved templates can help to ensure that all outbound messaging adheres to organizational standards, basically controlling the message to minimize the risk as much as possible.
And as you mentioned, this will probably vary from organization to organization, so the platform can be set up to align with different standards. Is everybody at UT Medical Center using this new outreach solution?
We started out with about 6 units as a pilot, but as of last week, we began rolling it out to our entire medical center.
To me, this brings to mind an idea I've heard before. Disruption happens gradually, and then it happens suddenly. We've certainly learned a lot from the healthcare organizations we serve, and it's been fascinating to watch customer feedback turn into a tangible piece of technology deployed to the medical center so quickly. I'd also like to add that although Brant is talking about an inpatient use case for this solution, healthcare organizations are also needing to consider ambulatory practice settings when considering patient engagement. While many ambulatory practices are exploring or even implementing telehealth visits versus face-to-face visits, there's also a tremendous need in these settings to send schedule-driven text messages to patients with upcoming appointments. Maybe it's to initiate a screening process for patients who are exhibiting COVID-19 symptoms, or to let patients know that the office won't be handling non-emergent cases until a certain date, and that they'll need to reschedule their appointment as a result. PerfectServe's patient and family communication solution is capable of handling those more sophisticated outreach modes, but with more engagement on the front end. That leads me to a final question. Change and upheaval are somewhat commonplace right now as organizations around the country pivot quickly to respond to COVID-19. But what happens with patient engagement after the crisis, in your opinion?
I can't predict the future, but I think a lot of lessons are going to be learned and remembered after COVID-19. With value-based care, we've got to leverage simple, effective ways to engage and communicate with patients to ensure they're receiving the care they need to be happy and healthy. The COVID pandemic has been unsettling, sad, and frustrating for all of us in different ways. Our outlook on healthcare will likely be changed forever when the dust settles. But the pivot to telehealth and the work PerfectServe and so many other companies are doing to create solutions that meet the needs of our current situation, I think many of the insights we're learning today will guide the way forward. Promoting better health outcomes in our country means removing boundaries between the providers and the patients. We'll make it through this crisis with a clearer idea of how to make that happen.
I agree, Brant, and thank you for your time today. The information presented and the work UT Medical Center is doing is both insightful and at the same time hopeful. Our final speaker today is Lana Vant, a systems analyst at Bon Secours Mercy Health. Many of you likely know this already, but to set the stage, Bon Secours and Mercy Health joined forces at the end of 2018 to become Bon Secours Mercy Health. PerfectServe had a long-standing relationship with Mercy Health before the merger, and we continue to work with them as a combined entity today. The COVID-19 communication story for Bon Secours Mercy Health is multifaceted, which is exactly what you'd expect for a provider organization of this size with many different facilities. You'll find that for leadership, providers, and patients alike, the clinical communication platform has been the linchpin that connects disparate parties across multiple sites and ensures all relevant information, from organizational updates to COVID-19 patient alerts to virtual visit requests from patients, gets routed to the right place. Lana, first, our sincere thanks to you for joining us today. We know firsthand how busy you've been and will continue to be. Can you tell us a little about Bon Secours Mercy Health and your role in the organization?
Sure, and thanks for having me. It's always important to share this kind of information when so many people are trying to figure out the best way to respond to a crisis. Bon Secours Mercy Health is one of the 5 largest Catholic healthcare systems in the country and one of the 20th largest health systems in the U.S. overall. We have 48 hospitals, over 1,000 sites of care, and a presence in 7 different states. As far as my role, my background is a med-surg nurse with 10+ years of bedside experience, and now I'm an applications analyst that supports clinical applications used by our staff in all areas of care. Most predominantly recently has been PerfectServe. I've been working closely with them to expand our use of the application.
I love that we have such great nursing experience and a mix of roles speaking today. It gives us such valuable perspective. Thanks for telling us about your career path. Now, thinking about Bon Secours Mercy Health's COVID-19 strategy, and specifically how clinical communication has played a role, it appears most of the activity has fallen into 3 buckets that I'll broadly call transfer center, corporate, and telehealth. Is that right?
That's exactly right.
Okay. Let's start with the first one and dig into the details. Can you tell us about the transfer center's role in this process and how communication evolved to meet current needs?
Sure. Our transfer center services are provided by Conduit Health Partners, which is wholly owned subsidiary of Secours Mercy Health. I'll call it Mercy Conduit for short. As with any transfer center, this is how out-of-network patients make their way into our system. And as long as we can provide the care a patient requires, Mercy Conduit will make the transfer happen. The nurses at Mercy Conduit all use PerfectServe, so anytime there's a transfer possibility, they reach out to the appropriate group through PerfectServe to see if we can accept the patient in question. With COVID-19, we wanted all communication from Mercy Conduit about confirmed or suspected coronavirus to be high touch with visibility from leadership.
And how did you make adjustments to meet that goal?
We worked with PerfectServe to set up what I'll call COVID CMO on-call coverage, which is quite a mouthful. The gist of it is, for all of our 14 regions, we now have an on-call schedule built for our hospital leadership specifically for transfer requests involving confirmed or suspected COVID-19 patients. Now, any of these transfer requests coming from Mercy Conduit are routed through PerfectServe to the appropriate on-call leader, oftentimes the CMO, at the time of the communication. That person then makes the call about accepting the patient based on their facility's current situation and available beds and resources.
That makes sense. Giving leadership full visibility into the COVID-19 situation at their facility. Now, what about the communication going the other way, from a hospital to a transfer center? Any special communication workflows there?
Actually, yes. We thought about that as well. Previously, in times with lower communication volume, all inbound communication from hospitals got routed to one phone. And as you can imagine, like many other health systems, we're seeing a lot more urgent communication these days. We wanted to make some adjustments at the transfer center to handle the heavier load. Again, working with PerfectServe, we tweaked some permissions and routing rules in the platform to equip more nurses at the transfer center to receive inbound communication from all system hospitals. By spreading out this coverage, we're ensuring increased access to the transfer center for hospitals in the Bon Secours Mercy Health System at a critical time.
It sounds like the transfer center is an even more important communication hub than usual right now. Have you had to increase your staff there?
Yes. Mercy Conduit is now the main gatekeeper for COVID-19, and PerfectServe is central to their operations. We've probably added about 75 or more nurses to the transfer center staff during the COVID-19 pandemic.
Okay. So the transfer center is staffed up and serving as a central hub. Let's move to the second prong of your COVID-19 communication strategy, which I've labeled corporate. What can you tell us about changes here?
There are two things I'll highlight here: distribution lists and team alerts, which are common in the PerfectServe platform and extremely useful in times like this. For the former, our leadership team wanted a secure and easy way to engage in discussions and exchange important information about the COVID-19 crisis, such as where the next outbreak was expected within our system and updated internal guidelines. By setting up new distribution lists in PerfectServe specifically for leadership, they've all got access to a group chat that allows them to discuss sensitive information in a secure environment. It sounds simple, but it's a great resource.
Absolutely. And I imagine the usefulness of a distribution list is really underscored during a situation like this. Moving on to team alerts, how do those differ? And what's the COVID-19 use case?
I like to think of the team alerts more as a one-way communication aimed at disseminating information to a larger targeted group. We wanted a way to send this kind of mass communication to specific locations within our system, since the impact of COVID-19 was likely to differ from facility to facility. It's not one-size-fits-all situation.
Right. And setting up multiple team alerts, which could be delivered to hundreds of on-call or currently working users at once, allows for communication tailored to specific locations. What might an example of this look like?
If say, Cincinnati would expect a spike in COVID-19 patients, or if they needed to know that additional ventilators were being sent their way, a team alert with that information could be quickly delivered to a targeted list of personnel who are vital to that location's COVID-19 response efforts.
And what's the significance of a one-way communication in this case?
There was a strong desire among leadership to keep communication as streamlined as possible, so a one-way team alert locks down or prevents replies from being sent. This isn't a group chat. It's important information being sent to relevant parties through PerfectServe to prepare, mobilize, update, or otherwise educate them.
Excellent. Moving on to the final prong of your COVID-19 communication strategy, let's talk about telehealth. I understand Bon Secours Mercy Health has an existing platform for virtual visits. So how does a clinical communication platform like PerfectServe factor in here?
That's correct. Prior to COVID-19, our patients already had the ability to go online and schedule a telehealth visit. If providers wanted to be part of the rapid access team, which handles coverage for these virtual visits, they could just sign up when they weren't in the clinic.
And with virtual visits being encouraged whenever possible, I'm sure you've seen an increase in activity here.
Yes, we have, and that's where PerfectServe is helping tremendously. Now providers on the rapid access team are being assigned to specific states, and thanks to PerfectServe's routing capabilities, a patient in Virginia or Kentucky can request a virtual visit, and that request will make its way to the correct provider based on variables like state of origin and date.
Amazing. So PerfectServe is eliminating delays and coordinating your telehealth visits by providing robust routing, which allows visit requests to be scheduled in a timely and accurate manner.
That's right.
Well, Lana, I feel like we've covered a fair amount of ground in a short time, so maybe I'll just ask you for any closing thoughts.
I'll just say that these communication workflows have been absolutely vital to our COVID-19 response efforts. And I encourage everyone to think about ways your clinical communication can be improved or modified to meet the special needs of a public health crisis. PerfectServe has really stepped up in our time of need, and I hope other healthcare organizations have seen the same thing from their vendor partners over the past few months.
Thanks for those kind words. And I'll just say we're thrilled to fill these needs for you and your colleagues. We certainly understand the importance of effective communication and how it impacts patient care, especially when many other variables are out of your hands. I'll take another pause and do a quick polling question before we head to Q&A. How is your healthcare organization trying to reach potential COVID-19 patients or cases before they walk in the door? Is it patient outreach or surveys via text messaging, app, or email? Phone screens for patients with scheduled appointments? Checking temperatures at the door? All of the above, or other? I'll pause a moment and allow those of you with healthcare organizations to consider and respond. and let's evaluate our results. All of the above seems to be the most common response. Nearly half of you are doing a mixture of things in order to engage your patients before they come in the door. Many of you checking temperatures as well. So interesting results to see there, yet not surprising. Thank you to Robin and Brant and Lana. I cannot say enough about how valuable the frontline health workers are during this time, and quite frankly, all other times as well. The use cases presented today have really given us all a lot to think about. Now, I'd like to hand the event back to Becker's Healthcare Review for the question and answer portion of today's webinar.
Thank you, Julie, Brant, Lana, and Robin for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. So let's jump right into the questions. Our first one here is, how are providers responding to using text alerts to update patients' families in lieu of face-to-face communication? And there's a second part to the question, which is, have you considered using video capabilities beyond telehealth visits?
This is Brant. I'll take that. So for our providers who are using this to send text alerts to their patients' families, we have already had a communication strategy in place where we try to, at least once a shift, have a phone call with the family. And then from the phone call early in the shift, we then use the platform to send update messages throughout the rest of the shift, and then a kind of an end of shift message before the next nurse comes on, and then that next nurse will then have a phone call and follow that same pattern. As far as video capabilities, we are strongly considering it at this point as another tool in our toolbox to help us provide the best care for our patients.
Thank you so much for providing those additional details, Brant. Our next question here is, I noticed Perfect Serve offers a scheduling solution. It's crazy trying to manage schedules right now. How can you help?
Excellent question. This is Julie. I'll answer that one since we didn't have a speaker on today's webinar regarding scheduling. Perfect Serve does offer both simple and robust scheduling platforms within our portfolio. So initially, I would say there are some medical groups that have somewhat simple schedules and can manage those quickly and effectively through our web-based platform, also available through the mobile application, so they can make real-time updates and changes as providers need to. For larger groups or groups with more sophistication in their scheduling, perhaps they're spread across multiple locations, they have multiple rounders at different times. As we see changes in staffing models, either based on needs for quarantine or isolation, or just simple protocols in place for team-based scheduling, these solutions, including our Lightning Bolt solution, which is a robust scheduling tool that allows quick and easy dynamic changes to schedule manipulation for any of these reasons, can be used with a very quick and short setup time for any ambulatory or hospital practices. So if you'd like more information about that, you can certainly reach out and we'll have someone follow up with a demo of what our Lightning Bolt solution includes.
Fantastic. Thanks for telling us a little bit more about that. Our next question here is, so do COVID-19 patients use their own phones to message their providers?
Ms. Brant.
So I think go ahead, Brant. I think all of us could probably touch on that, but I'll let you talk about how UT is handling this.
At UT Medical Center, we have an iPad on every unit for this situation so that they aren't having to use personal devices to reach out.
Got it. Thank you so much for clarifying that. Our next question is, when a CMO or other hospital leader approves the transfer of a potential or confirmed COVID-19 patient, are there any communication workflows that trigger to prepare clinical teams for the patient's arrival?
Hey, Lana, I'll toss that one over to you, and you can let us know how Bon Secours Mercy Health is handling this.
Well, I'll have to be honest, I'm not aware of the workflow specifically after that, besides the appropriate clinical staff are notified of the patient arrival and what needs they would have.
Okay, thanks, Lana. And that's okay. We know everyone is kind of part of different areas of organizations and different workflows. What we have seen in other organizations that we've engaged with as we've changed or updated or created new workflows for this is either as a result of a distribution or a team alert. CMOs are often being engaged when inbound patients are needing to be transferred into the organization. And so they receive a real-time notification that a bed is requested for a COVID-19 patient, and that allows them to appropriately manage both the medical staff available, the nursing area or the bed unit availability, and so they have a real-time view into all of the different components that are necessary to continue to appropriately care for these COVID-19 patients. So that seems to be the most common way that we are engaging with our organizations to manage this particular workflow.
Great, thank you so much for that. Our next question here is, communication to staff when a COVID-19 patient is admitted varies based on the severity of the patient's condition. Could you talk a little bit about what those variations look like?
I'll take that.
Robin, would
I'll take that. Sorry, I was trying to get myself off mute there. Sure. So for Prisma Health, a lot of our patients start off in a tent location, meaning that they typically come through one of the tent locations outside of our emergency rooms to get an evaluation. Then based off of that evaluation, there are a couple of things that are determined. If the patient needs to come into the emergency room to be worked up, then they're sent into the emergency room. If they're simply needing a test, they are given a test and they are sent home. For those that do come into the emergency room, depending on the results of what we find with those patients, some of them do get hospitalized. The ones that get hospitalized, basically that's where we start using some of those other COVID-19 communication efforts that we have. So when patients actually are brought in, a COVID message is sent to our hub, and if a patient is found to be under investigation, but then once they are marked positive, all of that gets communicated through Telemedic and through that hub. Then if the patient is considered one of those critical patients, they're moved to, like I said, we have a facility here in North Greenville that is a site dedicated to treating those patients. But then in our lower areas of the state, we have dedicated floors in different hospitals that they go to. When those critical inpatients are on those units, then that is when the merit alert can be used for those patients that could possibly end up needing intubation. But then going back to, and that's like our most critical patient, but then going back to the patients that get sent home, what's pretty neat about one of our COVID-19 tools that we've created is that we have a community partners message type. And this is for the patient who was sent home either because they got a test and went home because their symptoms didn't make them have to be hospitalized, but they're starting to feel worse, or they've been discharged and they're starting to feel worse. They can reach out to the community partners through a telephone number we've built out in Telemedic, and what that actually does is it reaches out to a paramedic who will actually go to the home and check on the patient. So I hope that kind of helps explain. We have a whole gamut of ways that we are checking and communicating on the patient's condition based off the patient's severity.
Great. Well, at this point, I'd like to close off our Q&A portion of the webinar. And I'd love to ask our presenters, Julie, Brant, Lana, and Robin, if they have any final thoughts.
I would like to say, one, thank you, Perfect Serve, for bringing this together for all of us to share our stories. I do, like I said earlier, I do feel like in a crisis, it puts us all in a boat where we have to put our best foot forwards in a time that it can be very scary. So I'm truly grateful to have been a part of this presentation and to see all the different wonderful ways all these systems are coming together to meet their patients' needs.
I'd second that. Appreciate it. If we don't share our journey with others, we can't grow. So we appreciate the collaboration with Perfect Serve and these facilities, and we're trying to do the best we can for our patients here.
And this is Lana. I would like to give a big thank you out.
Oh, I'm so sorry. Go ahead, Lana.
That's okay. I'd like to give a big thank you out to Perfect Serve because we have worked very hard with them, and they have responded extremely quick to our massively growing needs for communication, and it has affected us tremendously.
Fantastic. Well, I would just like to thank you all for your excellent presentation and Perfect Serve for sponsoring today's webinar. This is all the time that we have for today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.